methadone is substituting a drug for a drug. It's actually substituting an opioid for another opioid. And I'm on methadone right now. I've been on it for 20 years. I'll probably be on it for the rest of my life. But, I have a satisfying, stable life. I get to work a job and have good relationships and all that stuff. So, I think the principle of substituting a dangerous, unknown street drug for a pharmaceutical drug of known potency, that's methadone. But it's also what we call safe supply. And I believe that's the way out of this mass death.
Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart. The drug war has long been a controversial issue, often fueled by moral panic. But amidst this crisis, a movement is rising, a movement of drug users fighting to save their own lives. Garth Mullins is a former heroin user and activist who has transitioned from surviving the system to organizing for change. This week, we discuss his activism and his new book, Crackdown: Surviving and Resisting the War on Drugs. I hope you enjoy the conversation. This podcast is brought to you by TELUS Smart Home Security. Secure, simplify, and easily monitor your home from anywhere using the Smart Home Security app. Visit TELUS.com/smarthome-security to learn more about Canada's most trusted security provider. Hi, Garth. It is so good to see you.
Hey, thanks for having me on the show, Tamara.
So, I've been following you for so long. I feel like I've always known about you. And now you have a new book. You're laughing. In a good way, Garth.
No, I was just thinking about, I've always known you from being on the news and stuff like that. Like, as I've grown up in the city, you've been like one of the voices of the news,
Oh, well. And here we are now. We finally are talking. I can't believe we haven't spoken before. You have a podcast called Crackdown, but now you have a brand new book. It comes out April 15th. It's called Crackdown: Surviving and Resisting the War on Drugs. There it is. I have an advance digital copy that I've been reading. It's incredible. I guess, why did you want to write it?
Well, I was actually late to reading. I have very low vision. Like, I'm blind. I can see a little bit. If I didn't grow up in Yellowknife, I probably would have had a white cane or a dog or something like that. But they didn't know that stuff up there back then. And so I was late to reading. Like, I was really, I think I didn't get through a book until I was about 16. And so I didn't, and I was bad at spelling. Like, they used to teach spelling by like showing you the word and like you kind of remember what it looks like. So yeah, I was really slow on all that stuff. So I didn't think that I would ever write a book. I've just always wanted to communicate ideas by whatever vector, whatever platform, So I've been in like local punk bands since I was a kid. I had a radio show on community radio stations, I had a newspaper column in a paper called 24 Hours for a while until they shut that down. So whatever the medium is, I've just tried to use it. And, a few years ago when some people said, hey, you want to write a book for us? I thought, sure. Yeah, that's a good idea. I would be honored to. I'd love to.
So how do you describe your book to someone if they're like, hey, Garth, what's your book about?
I guess it's part memoir and part manifesto. So I started sort of writing this wonky book that was full of essays and footnotes and like not very much about my story, and I shared it with my best friend, Jeff, and he's in the book a lot because we've been best friends for 30 years, and he looked at it and he said, this is really interesting, but it reads like an encyclopedia. It's not really you, man. And I realized he was right, that my own story can carry a lot of those ideas that I was footnoting to other people or trying to push away from myself. And so I thought maybe it would be stronger to just own it and write my own story. My own story is of being a drug user, but also an activist. And so a lot of those ideas about how to change the world are something we talk about in meetings and demonstrations and organizing. So it just seemed a lot stronger. And then at the same time, while I was writing it, these people rolled their trucks into Ottawa, had a big occupation, and I think it was 2022. And I saw how organized they were and how many. And I thought, when those right wing people, when they find us, I'm worried about what will happen, because they were talking about the vaccine stuff, and there was a lot of disinformation and stuff going around. And I just thought that same world of disinformation, when it sort of lands on harm reduction and drug policy, it will just do so much damage. And here we are. But I just thought a personal narrative might survive that a little better. People can quibble about evidence forever and your sources, but when you say this happened to me, that's pretty strong, and if you write it in detail and you're vulnerable and you even show stuff that doesn't make you look that great, then you can't argue with that as much.
Yeah, that's such a good point. And I I think the most meaningful thing about telling your own story, sharing your own story, is that it it lets other people know that they're not alone, because um your story as a drug user is not unique. You're not the only drug user in the world. There are many drug users. And so, because there's so much shame and secrecy and, um, I mean, it's all been so politicized and everything. And like you said, there's misinformation. So people don't talk openly about it. So by talking openly about it, you're inviting people in to understand it better.
Yeah. I mean, I feel really lucky, because I was full of shame. A few years ago or several years ago, I would not have wanted to have this conversation or write the book or anything. I was, for most of my life, I tried to, keep my drug use secret. I was really embarrassed and ashamed of it. I just thought I was a terrible person. But, I started to meet other people at the Vancouver area network of drug users who were not shameful of it, who were like, we have to organize and, come out of the woodwork and show ourselves so that we can save lives, so that we can stop this death. And I realized that applied to me too. And then I realized also that maybe I was in a safe enough place. I have a union job, so they can't just fire me because they hear something in the news or they read a book and they don't like it. And Also, I have a stable place to live where there's no landlord that can just kick me out, or, if they find out I'm a drug user and they want to use that stigma against you. A lot of people are full of shame, as I have been, but also vulnerable to those kinds of things, like getting fired or getting evicted or having their family ostracize them or whatever. And, my family have, I've came out to them about all of this stuff and talked to them before going public about it. And so I think I have a relatively safe position, but I sure understand that a lot of people aren't in that position. I understand why people keep it to themselves, because you're right, it is still very stigmatized. And the things that's going on in politics, the scapegoating and fear mongering, it's just making us even more stigmatized and more sort of like pariahs.
You started using drugs and alcohol at a young age. Uh, w- why did you start so young?
Well, I mean,
Like, do you think about, what the reasons were?
I'm not sure entirely, but I was a really alienated and lonely kid. Like I said, I was blind, and I also have albinism. I'm an albino, and that sort of separated me from a lot of my classmates and little friends when I was young. Grew up, like I was saying, when I was a little kid, I was in Yellowknife, and everybody wanted to be, a hockey player or a bush pilot or a miner. I couldn't do any of that stuff. I couldn't be a hunter. All of that needed eyesight. I couldn't do the stuff that all the other kids were doing. And I just felt like I could never be an adult like them. Like I didn't have a future like them. And then uh, I just, I never felt like I had much of a place in the world. And then, later in Vancouver, there was somebody who was taking care of me and my sister, who is a kind of person who just should not be around kids, shouldn't be in charge of kids. And that sort of that sort of sealed the deal for me. I felt like as a terrible, like dirty reptile of a person, not even a human, just like this little waste boy. And when I found substances that could shut off the howling self hate and my own disapproval, then I certainly went after it. When it started with just booze and pot and stuff like that when I was 12 or 13. It took me several years to find heroin, but once I found it, it really quelled those voices perfectly, and I just felt normal. Instead of feeling like you might see on TVs, out of control and high or something like that. I just felt like good about myself and calm and centered and whole. And so once I felt like that, it was very hard to go back to that other state of being, that self-hate and alienation. So I went back for heroin as often as I could.
When did you first know that that you wanted to, I guess, like, I'm thinking about 12-step programs, or did your family intervene and say, "Hey, Garth, like, we know you're doing drugs and you gotta, we're gonna put you in rehab," or were you already out on your own and doing your own thing by the time that happened? Like, at what point did you know you wanted to change, or not change, you wanted to stop, or you needed to stop?
Um, yeah, I mean, by the time I had a proper habit, like a dope habit, heroin habit, I was 19. I was in California, and I got arrested for possession, and I spent a little time in a big, scary American jail. I also was like doing all sorts of things to try and get money to keep the habit going, including doing sex work. And so I wanted to have more control over it. It was a really contradictory feeling because I still wanted that feeling of, normalness, this feeling of, belonging and warmth that heroin gave me. But I didn't want to be broke. I didn't want to be in trouble with the law. I didn't want to be like overdosing. Um, and I didn't want HIV. It was hard to get syringes back when I first had a habit. So sometimes we had to share. So I did want to have more control over it. So I tried to get on the methadone program. That was after having a habit for several years, and I wasn't able to get on it because the spaces were rationed back then. I tried 12-step, and that made me feel worse. The Narcotics Anonymous sort of told me I was powerless, that I had moral defects, that I had a bad character. All of this sort of thing, made me feel worse about myself. Although I did like about 12-step is it brought people together who had the same experiences that I did, and that there was nobody else in charge. Nobody was making a bunch of money off you. Nobody was, nobody was insisting that you do something. It was up to you. But that didn't work for me. So, I did struggle trying to find a way to control my drug use. And of course, the very first way that I did that was just trying to kick, cold turkey. And I did that plenty. Sometimes I even made it through, past 5 or 10 days, but I couldn't make it last past a few months. So yeah, it was a long struggle.
You mentioned methadone, and we hear that often, but a lot of people don't know what methadone is. What is methadone, and how does that help someone?
Well, methadone's an opiate, like heroin is an opioid. It comes from the opium poppy, and so it's all the same class of drugs. Opioids include like fentanyl, heroin, methadone, Vicodin, oxycodone, Dilaudid, hydromorphone. All of those things are opioids. But methadone is, something that's prescribed from the pharmacy. You know exactly the potency of each dose. It's relatively affordable, or if you have pharmacare coverage, it's very affordable. And so unlike heroin or right now, what's sold on the street as down street fentanyl, you don't know the potency of that. And that's where the overdoses come from. is taking something that you think is one level, but it's much, much, much higher, and so you overdose and die. So yeah, methadone is substituting a drug for a drug. It's actually substituting an opioid for another opioid. And I'm on methadone right now. I've been on it for 20 years. I'll probably be on it for the rest of my life, but I have a satisfying, stable life. I get to work a job and have good relationships and all that stuff. So, yeah, I think the principle of substituting a dangerous, unknown street drug for a pharmaceutical drug of known potency, that's methadone, but it's also what we call safe supply. And I believe that's the way out of this mass death.
Right. Okay. And the reason I asked is because I have a friend that is a psychiatrist. And I mean, years ago, they would say to me, oh, on Saturdays, I work at the methadone clinic. I never really knew what it meant years ago. And I did not. So I've just learned something very valuable here because I did not know that methadone was considered safe supply. So we've been doing safe supply for a long time, right? Like if there's a methadone clinic where they give people methadone to get off their street drugs, that's considered safe supply.
That's right. And when methadone clinics were new, like in the 1960s, people in Vancouver protested against the first methadone clinic that was going to open. They said it was going to create street disorder and all these problems. And so they had to move it and put it sort of in near the hospital, on around 12th. But right from the very beginning, the principle of just that drug substitution caught some people the wrong way. But we had this guy, Dr. Holliday, here in Vancouver in the 60s, who really perfected the methadone maintenance treatment, which was just letting people, not rushing people off it, not giving them methadone for a week, tapering them off, and then forcing them off it real fast. I've tried that. It didn't work for me. But he said just letting people continue on it as they need it had a really good impacts that he found and studied it and published in peer-reviewed journals, some of those early studies in the 60s. And, that's spread around the world. It's kind of considered the gold standard of treatment. The difficulty is that methadone worked, pretty well for me and a lot of people who were using heroin. But once heroin kind of disappeared and we had street fentanyl, that's a lot stronger. And so you kind of need a stronger substitute. And that's why we have, for example, prescribed heroin clinic right now that has 100 people at it and has for many years on Hastings Street. Or small amounts of Dilaudid are prescribed to a small population in British Columbia. It's the same principle. It's trying to do that substitution.
I see. I think, Garth, that, a big part of the challenge, if you will, for people who are not drug users to understand is that they don't have the education about what all of this is. They just think drugs, bad, nobody can have them, just quit. And if you die, you die, not my fault, you chose to do them. Like, I feel like that's the narrative for so many people. And it's so layered, and every person is different and complicated. And the drugs are so different today than they were 20, 30 years ago.
Definitely. Let's break that down a little bit. There has long been this dream of a drug-free society and an alcohol-free society. For over a century, Canada and the US both tried prohibition. And before prohibition, people's favorite drink was wine or beer. But then prohibition comes and, people, bootleggers, don't want to smuggle around these big quantities of wine and beer when you can smuggle smaller volume, stronger moonshine, hard liquor. And people weren't used to hard liquor, and they didn't like the taste. And so that's where cocktails came from, mixing them with orange juice or Coke or something like that. And once we, made alcohol illegal and stopped regulating it, then we stopped watching what goes into it, and every kind of thing went into it, and people died. People got sick, people died. And so you can see in alcohol prohibition the same things that are happening in drug prohibition, like the tendency toward a stronger product, when you have to smuggle it around, that more bang for a buck, smaller volume, that stuff. And also the lack of regulation, meaning that lots of different things are in it, and people can die. And we also saw that the dream of an alcohol-free society was impossible, that people were just going to keep drinking. And the dream of a drug-free society has never really been effective outside of a few police states somewhere in the world, because people want to alter their their mood, their consciousness, whatever. But even in prisons, you can still find drugs. So we aren't really able to stamp out drugs on the supply side or the demand side. And the more we keep creating this sort of mean society where people can't imagine a future for themselves, the more people need to take the edge off. If you're growing up right now, like my nieces and nephews, I don't even know how they're going to make their way in the world, right? They got no way to get housing in this city, or get a job, or climate change could foreclose their future anyway. It just seems everywhere you move, you're trapped. And so we're creating more drug users by creating a inhumane world with no future for a lot of people.
But when we talk about the toxic drug supply, I think that that's where there's this huge understanding. And people try to, simplify it by saying, if somebody says, well, hey, if you do drugs and they're toxic and they have fentanyl in them, or carfentanil, I mean, it's changing so much. It's just getting worse and worse, the poison, and you die. Well, that's your choice. You chose to do that. And then people try to simplify it by saying, well, that's like saying, like you want to drink beer, and then you drink beer, but one of them is poisoned and then you die, and then there you go. I mean, no one should die because and here's the other thing. I'm kind of all over the map here, but I know what I'm trying to say. It's not just people. It's not just drug addicts that are dying, if you will, or, people have this horrible, like we're in Vancouver, you and I. So a lot of people talk about the downtown east side, and they think that every drug user is concentrated to the downtown east side. I mean, it's just not true. Drug users are everywhere in this province. It's just that when high profile persons, who or they're wealthy, and their kid dies in their bedroom from taking, a toxic drug, you don't hear about it because there's shame. And so people don't share their story. I mean, drug users are everywhere. And why should a 16-year-old, because we know kids have died, go to a party and say, hey, take this pill, like we're all, and they take the pill and they die? That's what we're talking about, all human beings here. This is not that it makes it okay to say, oh, well, it's just downtown east side. It doesn't make it okay. But you know what I'm saying, right? Like, this affects everybody.
Yeah, the coroner finds bodies in every part of the province, in every type of neighborhood. A half of the people were getting up to go to work the next day. And lots of people work in the resource sector, and people like to blow off steam sometimes. It's hard work. I worked in mining. When people got off from a 2-week shift, they like to, tear it up. And sometimes that meant a couple lines. And now there's cross-contamination with cocaine. So people die just doing that, just doing a couple lines in the bathroom at the bar. So it doesn't mean that somebody has to live on East Hastings and have a daily opioid use kind of habit. People are dying everywhere. And, I think that's important for people to recognize that pills have also, especially when we made them scarce, people press pills, and they don't contain the thing that you think they contain. They contain fentanyl, right? So there's fake pills that go around. So you might even think that pills are safe, but unless they're prescribed to you, you don't know. And it's probably worth getting them tested. But students who are maybe in first year university are feeling a lot of anxiety. They're away from home. They got exams. So maybe they want to just take some Xanax, but they don't know. They don't know what's in the Xanax. And so people die. And on university campuses now, there are naloxone kits in little, little kind of cabinets on the walls of some public spaces because they're recognizing that, and I'm glad that they are 10 years deep into this public health crisis. I think we should admit that. But we're not only fighting toxic drugs, we're fighting toxic politics. And it's those bad politics that are coming from the right wing that are making this job so much more difficult, spreading fear and disinformation, and making the job of just having a evidence-based, science-based discussion about what we do, how we intervene, how we save lives, making it very difficult.
I want to talk more about that, but before we do, we always like to thank our guests for being here and your time. And so we ask our guests to choose a Canadian registered charity of their choice. You chose Wish Vancouver. And so we are going to make a donation in your name to Wish. Thank you for choosing them. I know Wish has had some challenges lately in raising money and things. And so this will be much appreciated by them. And they do really good work at Wish. So thank you for choosing them, Garth.
Mm-hmm. Yeah, they provide services for street-based sex workers. And, I think that's really important. The criminalization of sex work and the criminalization of drugs has this double impact of forcing people out of society and into the shadows. And so services to help people are really important. The services that were available to me when I worked in the sex trade a long time ago were very, very few and far between. But they included things like bleach kits, so you could bleach needles that you were sharing. And that probably helped me prevent getting HIV. So, I want to pay it forward. So thank you for helping me do that.
Well, thank you. A couple more things I want to touch on. One is there racism in the drug challenges that we have?
For sure. Yeah. The effects of the drug war fall hardest on around here on Black and Indigenous people, for sure. Means like that people are overrepresented in terms of who dies from overdose, who gets carded and arrested and hassled by the cops, the kinds of neighborhoods that get over policed, all that sort of stuff. And it goes back to the very beginning of the drug war. In 1907, there was a riot here in Vancouver against Chinese and Japanese residents. And it was this sort of white riot of fear and racism about immigration. And it has some scary echoes to what's going on in North America today. But they smashed up, the Chinatown and the area around Powell Street. And after that riot, Ottawa sent out a bureaucrat to compensate people whose windows were smashed, business owners and stuff. When he was out here, he found out that there was that people were smoking opium and that it was being manufactured in the area. And he was outraged and morally offended by this, not by the drug, but because he felt that it was a nefarious foreign influence that was negatively affecting white women and girls. And so there was a real nasty racist narrative to all of this. And the fear that was generated from this and the panic helped this guy turn from a bureaucrat into a MP. He got elected. He became a minister. Then he became Canada's longest serving prime minister, William Lyon Mackenzie King. And some of his big policy achievements, or what he's known for, was the drug war, was also, essentially banning Chinese immigration for a long time, the head tax, and also getting advice from the spirit world by having seances and talking to his dog and stuff like this. So this guy used racism and fear to propel himself to high office. And I think that some politicians on the right that are around today are good students of history, and they realize that mix of fear about drugs and fear about immigration together can help propel them to high office. That they can stampede voters into, backing these kind of policies and approaches that are uh, like absent real evidence and are just full of knee-jerk kind of responses. So yes, the drug war is racist, and it's not that if we stop the drug war, racism disappears. But you can't defeat white supremacy in Canada without defeating the drug war. It has so long been a major plank of white supremacy. In fact, the very first drug prohibition law was the Indian Act, and Indigenous people in Canada were the first people banned from using different substances. I think just we need to get rid of the drug war to save lives, but also because it's right, because from a social justice perspective, like we just can't continue this sort of thing.
Hmm. If somebody today wants to get help, like say somebody in Vancouver, because there's a lot of people think, well, hey, if you want to stop doing drugs, you just got to ask, and then you can get support, and you can just, we'll get you in a place. And I know the answer to this. So, if somebody wants help, how easy is it to get help today?
Well, it's not very easy. If you want to go to some kind of recovery program or something like that, there's a lot of waiting on a list to get a space at detox, waiting on a list to get a space at then a recovery place, and there's then where do you go after that? Housing after that? It's very difficult. So when our government is talking about involuntary treatment, that is like locking people up and forcing them to get treatment. That's a very strange conversation because we don't have voluntary treatment. We don't have the kind of system where you can just put up your hand and go get help. But then also, what is help is not very well understood or well regulated. There's not good data collected on is it working and what's working. A lot of these places, they just insist on abstinence. They don't offer methadone or Suboxone. They don't offer the kinds of things that are evidence-based and proven. So even clearing up that would be an important step. And if somebody says to me, I want to get help for my son or whatever like that, I reflect on my own story, and that trying to get to abstinence, that is to get clean, to not be using anything, that's not easily done. That can take a very long time, if ever works. So maybe the better thing to do is try and get a prescription for a pharmaceutical version of the stuff you're using on the street, like the closest cousin to that you can find that someone will prescribe you, and make your goal to separate yourself from the street drugs, because that's what's killing people, not the stuff that's coming out of the pharmacy, the stuff that's coming off the street. So yes, you'd still be using drugs, but at least you wouldn't be, potentially dead that afternoon. So, like I take my methadone every morning, and I've done that for a long time, and it's working for me. People need something stronger right now to substitute for the stronger drugs that are out there, but the principle is sound. I remember when I was at this 12-step meeting at the recovery club there on, I think it's like 12th and Sophia. And they were just having a little chat. The people at the front who are leading the meeting were saying, "Hey, how many people are here for the first time?" And a couple of hands go up. And how many people are coming back for the second time? Lots of hands. Third time, fourth time, fifth time, sixth time. And what they mean by that is how many people have kind of gone through some process of recovery, then relapsed and had to go again, or you know like if you think about it, that process can take years. And if the drugs are deadly, you don't have years for a solution. You need something that will work that afternoon. And I was one of those people for whom it took years. And some of those years were in our previous overdose crisis that was declared by the public health officials in the 90s. So we've actually had two. And if we don't want this one to continue and to have more, then we've got to grow up and have an adult conversation about what we do about it, not just keep using answers from the middle of the 20th century that are more ideological than proven.
Mm. But okay, I have a question for you because I don't know this answer. So when you take methadone, this is a sidebar here. When you take methadone, are you high or is it like, do you know what I mean? Like, does it make you feel high or is it like if somebody takes an antidepressant? Like, I mean, there's many of us that take a prescribed drug every day. So why is the one that I'm taking for my well-being better than the one you're taking for your well-being? Do you know what I mean? Like, I think that that's the other thing. Like, why are people scared of methadone if that's what you need for your well-being?
I mean, high is such a clunky word, right? Like, even I guess sometimes if you're doing a lot of an opioid, you can kind of nod out a little bit where you're just like almost sort of asleep or kind of dreaming a little bit. Um, but for me, I didn't feel high. I felt like good. I felt okay. And so when you think about if you're taking your antidepressant, don't you feel better than if you weren't? Yes, you do. And so when I take the methadone, I feel better than if I wasn't taking it. Like like right now, I'm on methadone, but I don't think that the people listening to this podcast would think that that guy's high. But it's just like if I wasn't taking it, I would be in a terrible state of dope sickness and not able to talk to you because I'd be throwing up in the bathroom, you know? So, um,
Right. So but I think that that's the misconception, right? It's like, and so I chose the word high because that's what that's what we think of people who use drugs. You're high, and so, and you don't do heroin anymore. So now you take methadone, which is prescribed to you, and people seem to have an issue with this because it's also called safe supply. And what I'm trying to get to is that we have this description that's been fed to us of what safe supply is and how people are selling their safe supply now on the street and kids are getting addicted to this safe supply. And I mean, you and I could talk for hours about this and we're running out of time, but
well, I don't know. I don't know that that's happening, right? I'm not sure, Tamara, that that's happening.
I don't think it's happening, but we're being told this.
The very the very presence of a drug doesn't mean a kid's going to use it. Like, for example, just because alcohol is in a house doesn't mean a kid is going to become addicted to alcohol, right? Like, there's alcohol in lots of people's houses. But when I was a kid, I needed something. And, me and my partner are actually going to have a kid very soon. And I hope that we have a kid that doesn't feel alienated, that feels loved and connected and is really all there and doesn't need to fill the same void that I did. But if he does, or if he's just experimenting, then I hope he runs into a Dilaudid pill that was prescribed for safe supply rather than street fentanyl, so that he has a chance of not dying, right? And for me, I don't like I know I know people who are on those prescriptions. I know some people who sell them. I know who they sell them to because it has been me. And it's people like me. There's very few of these prescriptions around, so it's not easy to get. And sometimes I haven't been able to just use methadone. Sometimes I felt vulnerable, like I was going to use street drugs. And instead, I was able to buy a bit of Dilaudid, be safe, feel a little bit something more, and not risk overdose and death from street drugs. And I think that's mostly who's buying those drugs. And in fact, I've used Dilaudid this way going back to the 90s. Dilaudid, hydromorphone, whatever you want to call it, has been available to buy diverted since the 90s. Probably before, but that's when I was aware of it. Because most Dilaudid is not prescribed in BC for safe supply. It's just prescribed to people for pain. And most of it's that's sold on the street, as it has been for decades, is sold from people who have it prescribed for pain. We got to ask, why are people so poor in this province that they have to sell their own medication? I mean, that's the crime. That's the crime here.
Mm-hmm. So good. I've been prescribed hydromorphone. I had C-sections. I had cancer surgery, and guess what they prescribe you? So it's about education. And it's about, and I mean, listen, when I was saying that, this is what we are told, Garth. And when I say we, I mean the general public, right? We're told this all the time in the news. We're told it in, we hear politicians saying it all the time. They bring a grieving parent into the legislature. This person's child was sold a safe supply and they died. And, all of these things. And so
Tamara, it's such an old pattern. It's such an old pattern. We keep repeating this going all the way back to 1907. It's a moral panic. Back then, it was like, oh no, white women and girls are imperiled by these nefarious dealers from a foreign country. And now it's Dilaudid. And in the 90s, it was crack babies. There's just always this moral panic thing. And eventually, we have to pull the plug, and people in journalism have to say, I'm not going to be a part of that. And congratulations to you for not being a part of that. And people out there who are the voting public are say, I'm not going to be a dupe. I'm not going to fall for it again. So we all have to grow up and realize the stakes are really high right now, not just for drug users, but for every kind of politics on the planet that's now being infected by this toxic right-wing disinformation. We all have to shake it off, or we're going to be in a very scary, bad place.
I agree with you, Garth. And, we're out of time. And honestly, I feel like I could talk to you for a week about this. You're so generous with your story, Garth, and you're so informed about all of this. And I really appreciate you, opening up and sharing. Your book, hold it up again, is called Crackdown: Surviving and Resisting the War on Drugs. It's released on April 15th. It's available wherever you can pre-order it now. And you can also listen to Garth on his podcast. You can find his podcast. The name of the podcast is Crackdown, and you can find more information at crackdownpod.com. Garth is also on Blue Sky at garthmullins.bsky.social, and he's on Instagram and TikTok at Garth Mullins. And congratulations on your soon-to-be baby. And thank you so much, Garth. It's been such a pleasure.
Thank you, Tamara. Thanks very much. And for all of your work in journalism over the many years here in Vancouver. Thanks.
Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.